Can everyone hear me? Okay. So I just wanted to say thank you very much for welcoming me and having me here today. This really means a lot to both myself and my family and many of my friends that have mitochondrial disease. So, can we move to the next slide? So I basically just wanted to tell you a little bit about my story. And my family actually was diagnosed by Children's Hospital of Philadelphia with MELAS, or mitochondrial encephalopathy lactic acidosis with stroke. And basically, I noticed that something wasn't right. When I turned 15 years old, I was running in a track meet, and I had what they called a heat stroke. It didn't really add up. I had been running for a while. I was very much in shape, and it just didn't really make sense. So the timeline progresses. My grandmother, at 61 years old, died an absolutely terrible death. At the time, they really didn't know what caused her death, but the doctors described it to me as something was eating her brain. So essentially a progressive neurodegenerative disease. My mother had a stroke at age 40. She was very much in health. She looked very much like me. The doctors were quite shocked. And she now has dementia, and she also has hearing loss. My daughter, at her 18-month-old birthday, she started having staring seizures or absence seizures, and she just wasn't behaving correctly. She was, a very active child at 18 months. She always looked happy, and she just looked sad. She looked like something was definitely wrong and that she was in pain. So I took her to Children's Hospital of Philadelphia. Dr. Marnie Falk was the person that diagnosed her. This was the first time that MELAS was diagnosed to my family. And then we finally knew what was wrong. And a lot of it added up and made sense at the time. Since the diagnosis, I had the birth of my son, Matthew. He was born via IVF and pre-implantation genetic diagnosis. So basically, there was a lot of risk associated with that. But at the time, I felt that it was the right thing to do. And he is doing well now. My daughter as well is doing very well. She's actually considered somewhat of a miracle. She has a very high mitochondrial DNA or MELAS mutation, but she's actually a little bit at the end of the spectrum. She walks, she talks, she's not in a wheelchair like many children are, and we, really thank God for that. But at the same time, she has days when she's not feeling good, especially when she's sick. And her legs hurt, they're tired. She actually ran track, and she did extremely well at it. She could beat the boys. But the problem is she actually, at one point, was running a mile race, and she was winning by a long shot. However, she lost her vision shortly after that. It was a temporary loss. It came back. But it's just to show you that this terrible disease does have a very large impact. So that's something to take into consideration. My uncle most recently died at age 52 of cortical and basal ganglia calcification, is what they diagnosed it as. This was down in Florida. He had dementia that began at age 12. Schizophrenia is what they specifically diagnosed him with. He also had uncontrollable diabetes and deafness, and he was in a wheelchair at age 40. So that's one severe case to myself, which isn't as severe. My mutation is, in fact, on the lower side, but I still do, have the mutation. And I have deafness. I don't have type 2 diabetes yet, but I've basically been told that that's pretty much certain, and that'll be coming. But I'm able to walk, I'm able to talk. And sure, when I'm sick, there are mornings where my muscles hurt, and they hurt a lot. And I'm just very lethargic. But I was able to go to graduate school. I gained my doctorate in neuroscience. I currently work for a large pharmaceutical company, and I love what I do. So I'm very happy that, I was given the chance for life. Okay? So my personal belief, and this is why I'm so grateful for being here today, this is a slide that I show at work very often, But if you always do what you've always done, you will get what you always got. And I think the real purpose of this slide is to the committee and to others from the FDA to think differently and to change the course of history. I think that's very important. We have the opportunity to potentially make it so that future generations do not have to suffer from this progressive neurodegenerative disease. And I think that's very important to me. This is my daughter, Grace, over to the left. So I think there are many benefits of mitochondrial DNA replacement therapy. First, it allows females like my daughter the opportunity to have children with your own nuclear DNA. It decreases the incidence of terrible neurodegenerative mitochondrial diseases, and it decreases the number of hospital visits and hospital costs associated with treating patients with mitochondrial disease. Now, granted, these are all potential benefits, but I think that that's something that is definitely applicable, because I know that the healthcare expenses associated with my family alone are significant. Okay. In my opinion, this is my personal view. We create medicines for patients with diseases. I do this on a daily basis at my job. And why wouldn't we create a cure, a quote-unquote potential cure, for future children who would otherwise suffer from a disease where there is no treatment? And I think that's important to state that. That's my view. So I was asked to address specific ethical questions in the literature and what I've seen that commonly occur. So this is my perspective, again, only my perspective, but does manipulation of mitochondrial DNA allow people to design babies to their specifications? In my opinion, no. When you make, you know, I know that there's a lot in the news and in the media with regards to, you know, are we going to be choosing the hair color of our babies? Are we going to be choosing their intelligence? No, that's in the nuclear DNA. From a scientific perspective, this is the mitochondrial DNA, and it doesn't behave the same when replication occurs, from what I've read. So in my opinion, the answer is no. Why can't women with mitochondrial disease use egg donors or adopt? This was actually something that came to me. And I looked into both approaches, I'll be quite honest. I felt that personally, my nuclear DNA, there's nothing there. It's perfectly healthy. And you know, I love basically what I do, what I've been given, what I was inherited with, and I really wanted my children to personally have that. But replacing the mitochondrial DNA would eliminate the prospect of this terrible neurodegenerative disease, and that's why, you know, I'm so interested in this. The egg donors, you know, it's expensive, and I agree with that, but adoption is expensive too. I think it was something like the average IVF procedure costs between $12,000 to $15,000. I was looking at this the other night. Whereas when we adopt, it's extremely expensive. When I looked into adoption, I was quoted approximately $30,000. It can range anywhere between $5,000 to $50,000. So that's something to consider. And then you also take risks associated with both. But in my opinion, the emotional risks associated with the adoption and the fact that the adoption could fall through, that was very hard for me and hard for my husband to take on. Are there ethical, social issues if a child is born with donated mitochondrial DNA from one individual and nuclear DNA from another individual? In my opinion, the answer to this question is no, because it's my child, and that's how I would look at it. And in my opinion as well, they should know their genetic makeup. I completely agree with that from a healthcare perspective, but also in my opinion, it's very important that you know, they're able to understand that you're their child, and that's the same as if you use an actual complete egg donor. Okay. Does mitochondrial replacement therapy potentially cure a child who would otherwise be born with mitochondrial disease, or does it introduce genetic alterations such that a different child is created? In my opinion, I would go more so for the fact of the potential cure, but it is altering the genetic makeup. So it's not like you're treating with a drug after the fact. But still, it's eliminating this progressive neurodegenerative disease, which is very important. So my personal view on the ethical issues associated with novel, uncertain first-in-human applications, including health risks, assessment of benefit to risk, can consent be informed consent? I believe that with any clinical trial, and I've seen this at my work, you need to properly explain that protocol and obtain informed consent. So as long as that's done correctly, the answer to that is I do believe that the consent can be informed consent. Granted, this is really a first-in-human approach, so there's more risks associated with that, but with any phase 1 trial, you're going to see the same thing. So my view on the moral status of human tissue, manipulation and or destruction of embryos, this was very tough for me. I had to go through it with the IVF and PGD process. And in my opinion, I am Roman Catholic, I'll be very honest. So this was very tough for me to take on, but I also knew that it was necessary and that it would allow women in the future to be able to have children. Could the availability of MRT create a sense of obligation for families at risk for genetic disease to reproduce only with the help of advanced technologies? I do believe that, to a certain extent, many people will want to do this. Whether it creates an obligation, I'm not certain of that, but I do believe that, the majority of women will be interested in doing this. So there's obviously, there's costs associated with that, which I'll address as well. And not everyone is able to, take on those costs, but not everyone is able to take on the cost of taking a separate egg as a donor. Not everyone is able to take on the cost of adoption. Okay? So with that, I'm getting time. But I just wanted to thank everyone for inviting me today. This is something that I read to my children every single day from Dr. Seuss. Unless someone like you cares a whole awful lot, nothing is going to get better. It's not. So I think that this is the opportunity to take action. We're given the technology to be able to do this, and I hope we take advantage of it.
Thank you, and my apologies for having to do this, but...
Sorry.
No, my apologies. Spatial relationship is exactly where my IQ test always falls down, and so that's why you guys are all sitting up there. But Kevin, I can tell you're going to need an orthopedist after this. So why don't you all sit wherever you're comfortable, and then come up when you're doing slides, and then at the end, for sure, we'll have all of you up there. But just please be comfortable wherever you feel best, if you want to sit back.
One more logistics request. Can we have the speakers actually stand at the podium? Partly because the light is there, and rather than somebody showing you signs, you'll see the 2 minutes when the yellow goes off and red when it's done. But it was, Heather, your back was turned, not your fault. So successive speakers, let's have you stand at the podium, please.
Okay, and now with that, we'll turn it back over to Lori to introduce the next speaker.
Okay, so first of all, Heather, we want to thank you so much for giving us all a really important perspective on what we're all here to learn about and to talk about today. And again, this first workshop is really to give us the overall sort of overview of the ethical and social implications of MRT and to highlight the key characteristics of the techniques that we're here to talk about and to discuss the distinctive ethical and social issues that arise with these techniques. Our second speaker is Kevin Fitzgerald, who's the David...
Tom Murray.
Well, no. Kevin.
No, it was written incorrectly. It's
I know, but Kevin's up at the podium. So we're going to go with it. Well, it's okay. It's okay. It's okay. They're in the same category. So we have Kevin Fitzgerald, who's the David Lawler Chair of Catholic Healthcare Ethics in the Center for Clinical Bioethics at Georgetown University. So welcome, and thank you for going up to the podium. We're getting this down here, and I'm sure the second session will be more smooth because we're figuring it out here with the first session. Thank you very much.